Welcome to America's Heroes Group.
Welcome back to America's Heroes Group, our community roundtable outreach with our partner, AIDPH, which is the American Institute of Dental Public Health. Today is Saturday, February 18th, 2023. February is Black History and American Heart Month. Our host is Cliff Kelley. I'm Sean Claiborne, the co-host. Our executive producer is Glenda Smith. Our digital media producer is Ivan Ortega, Scouts Under Productions, and in charge of all things technical here, keeping us running smooth. We have our partner on the line. That is Dr. Annaliese Cothron. She is the co-founder and the executive director of the American Institute of Dental Public Health. She manages the program of fund development and the overall strategy of the AIDPH. We're talking about updates and new things going on with the AIDPH, and also the 2023 Washington, D.C. March is going to be on March 27th to 28th, called Hill Day. How you doing?
Hi, Sean. Good to be here again. How are you doing?
My pleasure. So pleasure's all mine. Great to see you again. So tell us what's going on the 27th of March, and what is Hill Day all about? I know we mentioned it a little bit before, but now I know we got some more details and things you want to talk about it. So tell us what's going on.
That's right. Well, as you alluded to, AIDPH and our oral health and veteran partners are heading to the Capitol for a day of education and advocacy around veteran dental care. And we've talked about this many times throughout the show, but, in case this is your first time channeling in today, or maybe this is a new topic for you, the reason why we are going to the Hill and we are pushing advocacy for expanded access to dental care for veterans is because 85% of veterans don't have access to dental care through the VA. So that's millions of veterans who are currently getting their medical care through the VA aren't eligible for dental care through the VA because of very strict criteria that's set in the federal code. So the federal code defines who is able to get benefits and how they are able to get them in terms of access within the VA. And right now, the federal code states that basically only veterans who are rated at 100% disabled through their benefits are able to access dental care. That leaves about 15% of veterans who are eligible through the federal code for dental care. And we here at AIDPH and all of our partners at the National Rural Health Association, at CareQuest Institute for Oral Health, at Veterans of Foreign Wars and Disabled American Veterans, and Paralyzed Veterans of America, Minority Veterans of America, we just don't think that's okay. And we're here to help lawmakers really understand the impact that not having access to dental care has had so far on veterans, and really present them with some good information about how we can be saving money by actually expanding access to dental care. And so we're coming to the Capitol with 3 asks in mind in the hopes that we can stimulate some policy action.
Now, you mentioned before in other shows that a lot of people, even who qualify for dental health care through disability, don't use it.
Yes. So of that 15% that are eligible, of that tiny slice that are eligible, we know that only about 30% utilize that care. And I don't have a clear answer as to why that's happening, but there's probably a few different reasons why. Number one, we need to expand the infrastructure of the VA to be able to give every eligible veteran the convenient and affordable care that they are eligible for. And, I think also, too, there's really long wait times because we just need to expand our infrastructure. But the piece that I really like when we're talking about the expansion of dental care within the VA is if you expand the eligibility and you expand the coverage, and if you don't have a VA location close to you to receive dental care, you can actually go into the community and get care that you need. So you're able to get the care coverage through expanded access within the VA. And then as the VA continues to expand its infrastructure and strengthen the ability to expand the workforce and provide care within the VA, until that point, you're able to get care through the community in a convenient and close location to you that's covered, financially through the VA.
Do you think people, particularly veterans, have a clear picture as how important dental health is to their overall health?
I do think so. I I truly believe that veterans desire good dental care, and I think that they understand the importance of dental care. And in fact, I've gotten comments before from a variety of entities who've asked that question and just say, well, maybe it's just veterans. Maybe they don't get it. Maybe they don't care. And what I like to remind everybody is every veteran has a mouth. It doesn't matter how you vote. It doesn't matter where you live. Every single veteran has a mouth. And our survey research that we've conducted throughout 2021 and 2022 very clearly indicates that veterans are aware that poor oral health impacts their overall health. In fact, veterans, when we ask them to rate their dental health versus their mental health and their physical health, they've rated dental health the lowest out of all three of those categories, meaning that they understand that the lack of dental care is actually manifesting in these really poor outcomes. The things that I've heard from veterans are, I'm struggling to get a job. I'm struggling to stay employed. I feel self-conscious of my smile. I actually don't go out with friends the way I want to because I feel like the state of my mouth and teeth is just so embarrassing that I'm not able to achieve all the things that I want to achieve in my life socially and financially. And so what we also see here is not just the self-awareness, but this unintended ripple effect of not having the dental care that they need. We're talking about economic ripples. We're talking about social ripples, mental health ripples. If you're not able to interact with people at your job or your friends or your family, or you feel embarrassed or self-conscious, that really has an impact on your whole person, right? And so that's why we're going to the Capitol to help educate policymakers on the value of expanding dental care, on the cost savings of expanding dental care. And we need everybody listening to help us tell that story. The three policy asks that we've crafted in collaboration with our veteran service organization partners and our other oral health stakeholders has been pretty clear. So number one, we're asking for expanded dental care for everybody who's currently getting Medicare or medical care. And again, remembering that even if it takes time to build out the VA infrastructure, having the coverage of care means that if you don't have a VA dental location close to you, you can still access affordable care in the community. And we think that's important. And so that's number one. We believe that all 9 million veterans who are currently enrollees of the Veteran Health Administration should have access to dental care. Number two, we are asking that veterans with heart disease and diabetes be prioritized in a dental care expansion. And we're asking that for a few different reasons. Number one, our research, which you can find at AIDPH.org. There's a tab right under research called Veterans. It's pretty easy to find, and you can see exactly what I'm talking about, how we've been able to quantify this. We know that veterans with heart disease and diabetes have more complications when it comes to their oral health. And actually, it's the other way around, too. If you have poor oral health, you're more likely to have heart disease and diabetes. Those chronic disease conditions can be exacerbated by poor oral health. So it's this bi-directional relationship between oral health and those chronic disease conditions. And what happens is if you can give oral health care to veterans with diabetes and heart disease, you actually save money on medical care because both conditions are managed better with oral health care. And you're also, importantly, getting veterans who are high risk into a more routine dental care environment where you can avoid things like infections or dental pain that winds up taking you to the emergency room. On average, going to the emergency room for dental pain or an infection costs about $1,500 a visit. And sometimes that's coming out of taxpayers' pockets.
Wow.
Because it's an emergency medical cost. So if we're talking about spending money versus on emergency dental care, that's probably not going to solve the problem. Or spending money on prevention, I know where my tax dollars should go. So that's really the focus of our second ask, is investing in prevention for veterans with heart disease and diabetes so that we can really get those folks the care that they need. And then lastly, we're asking Congress for, a true study of looking at the cost savings, right? Like, we've done our research, we feel very confident in it, but we feel like Congress needs to take a holistic look at how providing dental care for veterans could save taxpayer dollars, improve health outcomes, and ultimately create a better healthcare environment all the way around for veterans. You know, we keep mentioning that the VA expansion is important because the VA is the largest integrated health system in the nation. So, you know, we have 9 million enrollees that are all connected to the same record and get treatment planning from all the same people in concert with each other. So I can go see a medical care provider. I can go down the hall and see a dental provider. I can go down the hall and see a physical therapist. I can go down the hall and see perhaps my therapist for mental health. And because everybody can design care together to give the veteran the best holistic health care, that's why we're really saying the VA is the best position in terms of expanding dental care to give dental care. So all of those things are considered together as a veteran goes into a medical appointment or a dental appointment. But also, we want to ensure that that high level of care in a holistic setting, because of the VA, it's actually best positioned for cost savings. You know, we're talking about this chronic disease conditions that are exacerbated by poor oral health and vice versa. The VA is actually the perfect place to set up to get the highest level of cost savings and save those taxpayer dollars.
Now, how was that? Explain a little bit more clear. How was the VA in the best position is to see the cost savings?
Yeah, so because of that connection between some of these chronic disease conditions and where we have our evidence at the highest is heart disease and diabetes, but there are also some emerging evidence around dementia and stroke and other chronic disease or disease conditions that we know either exacerbates poor oral health or can be caused even through poor oral health. And so there was a study done by Cigna Healthcare, and I believe it's in 2016, that really calculated the cost of having to provide additional care for those chronic disease conditions. And because those chronic disease conditions cause gum disease and inflammation, treating that gum disease actually reduced whole person inflammation throughout your entire body. And that meant that your chronic disease conditions were actually better outcomes. So through those medical care savings, by providing effective dental care access, that's where the true cost savings are realized, is actually on the medical side. So we're saying we need to invest in a system that has those medical cost savings and expand it to dental care. So that way, if the VA is paying for you to go to the emergency department, if you have medical coverage, and now we're paying $1,500 every single time you go to the emergency department, why not just take that money and invest it back in prevention so that we have coverage? And we're also saving veterans pain. We're saving them time because we're giving them the care that they need in the beginning instead of having to, instead of having to go to a system in a setting that's not working for them. And I think there's some real implications, too, about having the emergency department serve as the place where you get your dental care, because they're not going to have a dentist there. They're not going to be able to actually fix an infection or pain. They're not going to do anything with your teeth. They're probably going to give you a prescription for an opioid because it's a very painful condition. You know, when you're coming in with some sort of dental issue, they're probably going to give you an antibiotic, and you're probably going to be back there in 4 or 5 months if you can't get it fixed anyway. So a lot of times when we're not giving the basic care access, we could be facilitating these other issues that are painful, costly, and really detrimental.
So kind of emphasize that point again, because you talked about how dental health can affect like your other chronic diseases. So if a person needs to get surgery, could that be held up because they have some kind of dental problem that has to be addressed first?
It's interesting that you mentioned that, because the veterans that I've spoken with, that's oftentimes the only time that they'll get access to dental care. Is, perhaps they're going into the VA for a cancer treatment, and in order to get a cancer treatment, you go through a full body evaluation, for instance. I was just talking to a friend that this happened to his dad, and he was in so much pain because his dad, had to start chemotherapy and radiation, and he was covered through all of that through the VA. And so as part of starting that standard procedure, his dad came to the VA. They looked in his mouth and they said, well, you have some pretty significant issues here. And because his dad didn't qualify for dental care, he had really substantial issues. Teeth had to be pulled. I mean, he was in pain actually in his mouth, but didn't have a way to pay for it. And so prior to getting his cancer treatment, he had to have all of his teeth removed.
Wow.
And the VA gave him dentures.
Wow.
And what that meant was this man, if he had just been able to get dental care sooner, he could have started chemotherapy sooner because he didn't have to go through all of that pain right before then starting another painful treatment. And he may have had better outcomes. So unfortunately, what we see is that when people do interact with the VA before surgery or before some of these other medically necessary practices or treatments, they will get dental care, they'll get an evaluation, but because they haven't had care for so long, the effects at that point are irreversible. We've also found, talking about irreversible effects, we know that that veterans living in rural areas in particular have the worst oral health outcomes. They have the highest chronic disease conditions, and they are about 40% more likely to lose all of their natural teeth and instead use dentures. What we consider in oral health, we consider losing all of your natural teeth. It's a word called edentalism. We consider that to be the ultimate, negative oral health outcome. That means that there's nothing else that can be done because you're just relegated to having dentures at that point. And so what we continue to see and what our data continues to tell us, and the story that we keep seeing from our data, is that far too many veterans are ending up there, not having any natural teeth at all, and just having dentures because they can't access dental care before that point.
Wow, imagine a world where dentures are kind of a thing of the past because people actually had access to dental care.
Right. Wouldn't that be wonderful if we could get ourselves there?
So the medical community obviously has known this and talked about this and preached about this for many, many years. Why is it that in our policy that we haven't addressed dental and vision? Because in Medicare they don't really address it. They don't address it in the VA system, and yet we've been talking about this for many, many years. So what do you hope that this event will do that will change that?
Well, I'm hoping we see some movement on some bills. There's one bill right now that we're keeping an eye on called the VA Careers Act, and that would actually give several different clinicians, including dental clinicians, support for going into the VA and getting licensure, and then going into the VA to actually expand and strengthen the current workforce. So that way, whenever we do expand access, that there is adequate workforce to accept that expansion. But we're also hoping to see more lawmakers paying attention, and if more bills are offered, we're there to say, okay, this is why it's important for you to pay attention to, and in particular, this is the cost savings that we're seeing. One thing I really want to impress upon people is, and I hear this a lot. I do a lot of advocacy. I was actually just at the Texas Capitol. I'm here in San Antonio, and I was just at the Texas Capitol this past week doing advocacy. And I hear so many times, does this matter? Are they listening? Are these lawmakers listening to us? Does it matter if we come and we tell them, and maybe we don't see movement this year or next year? And sometimes it can be really, really difficult to keep telling our story. But I want to encourage you that it does make a difference, and that these lawmakers really are paying attention. And it's a lot easier to pay attention whenever you're there, in front of them having these conversations. And what usually sticks with me are the stories of the veterans that I speak to, just like I shared right now about the veteran who got cancer. And, before he could even get any treatment, he had to get this really painful realization of removing all of his teeth because he just didn't have access to dental care before that. I was speaking to another veteran just a few months ago who had reached out to me after taking one of our surveys, and he had said, I'm just trying to get in to see a dentist. I do not qualify for dental care through the VA. We got him in to see, we got him actually enrolled into the VA DIP program. He qualified for that dental care coverage. We connected him to an FQHC, and we worked on his case for a few months. And he wound up saying, after all of that, I'm still having to pay $1,000 out of pocket. And he said, I just feel so embarrassed at work. I feel like I can't even go to work. I have halitosis. I feel self-conscious around my family. And that's the kind of things that I don't think you can quantify in a number. It doesn't matter how much research we put out and how much we talk about the cost savings. When we go to the Capitol, we need veterans to say the real human impact of what's happening in their lives. When they're sharing things like, yeah, here's all the statistics and the numbers, and that's important, but this is actually how it affects me personally. This is my real life. Those are the things that those members can then go to their counterpart. They could talk about it on the House floor. Those are the things that they keep in the back of their mind when a vote comes on a bill, is saying exactly how that person is affected. And it winds up creating context around those numbers. It winds up creating context around those statistics.
So Hill Day is March 27th and March 28th. Is it open to anybody that wanted to go to that event? Can any veteran or person who cares about this go and speak their truth and say what's going on and hear what's going on?
Yeah, if you are local to D.C., I would say reach out to us immediately. We're going to be scheduling visits. We're going to be given lots of tools to figure out how to tell your story, how to coordinate there. We're really partnered with the VFW. We're so thrilled that they've offered their space for the day of the 28th to be able to have lunch and fellowship and network. And so they're right across from the Senate offices. And we encourage you, please come. Please reach out to us. We'd love to get you the registration information. But also, if you can't come, you can't be in D.C. or you're not local, that's okay, because on that same day, on the 28th, we're hosting a virtual day of action. So we will give you some email templates if you're willing to send an email to your member of Congress and say this is why it's important. We're also holding some trainings before that event. You can get all of that information on our website, www.aidph.org. So we're going to prep you on the policy ask. We're going to prep you on why this is important. And also, we're going to give you some ideas about how to tell your story so that if you can't participate in person, that's okay. Your story is still going to be heard. We're going to give you the tools to be able to email your story to your members of Congress, and also just be visible on social media. We're going to be sharing hashtags, and we're going to be sharing social graphics, and there's lots of ways to make your voice heard, because all of it really does make a difference. Again, I know that sometimes it can be hard to determine, but every single time you make a point of contact with your legislator, that staff member is tallying every time they hear, man, I heard somebody say dental care to me 50 times today. I've never gotten this many emails before. That's actually a metric. They measure how many times they receive emails, how many times they receive phone calls. And sometimes the threshold could be as little as 3. Wow. You call 3 people call in one day, that means it's going to their boss. And so I want to really impress upon you that even if you're not there in person, you're making a difference. 3 emails in a day, all it takes is 3 emails for them to say, okay, I need to talk to my boss about this. So we're going to give you all the tools that we can find to stay visible, to stay active, and to help everybody talk about this across the nation.
And I think you mentioned this so many times on our show, but it's so important because it improves the lives of people. It improves the lives of veterans. So many positive things can come out of this, because now you have if you do this at the VA level, now you have a model that can be used at the national level. This is something that could be transported and maybe even implemented with Medicare. And the bigger point is this, as you mentioned, there's data and research that's real from all kinds of different sources, credible sources, that show you this saves money. Saves lives and saves money.
Absolutely. And we'd be willing to work with any local entity, whether that be state-based Medicaid or, even talking about options in Medicare, to show how this is both saving veterans money, saving taxpayers money, and ultimately improving our health and well-being across the board.
So what's the last thing you want to tell us? We have about 1 minute left. Make your pitch to the audience. Let them know what's going on, how important this day is. We want to get as many people out there to participate.
You know what? If I were to leave you with one thing today, I want to leave you with the 85% statistic, because I think that's the most important one, which is, 85% of veterans who are already getting their medical care through the VA don't qualify for dental care. So we're talking about an enormous wasted opportunity, knowing that veterans are going in, they're getting their medical care, and that they're really satisfied by that care, but they just can't get their dental care. And so for us to change that 85% number, it takes two things. It takes changing the federal code through a bill, and every single one of you has the ability to influence that. And then number two, it takes asking for some money behind the scenes. And as we've mentioned, our research actually indicates cost savings. And so there are some positive budget implications here after we change the federal code of actually saving dollars after that expansion. So I hope if you have the time to join us on the 28th virtually, that you'll be able to do that at www.aidph.org.
Reach out to AIDPH. This is Dr. Annaliese Cothron. She is the co-founder and executive director of the American Institute of Dental Public Health. Thanks for your time.
Thank you.
This is America's Heroes Group. We'll be right back.